All right, good morning, everybody. Thank you for joining us for our press briefing. As we noted, today is the first day of the legislative session, and so we are going to try to wrap this up before 10 o'clock so that the legislature can gavel in and begin their business. We don't want to get in the way of that. So we'll get right into it. Again, I want to remind people, please continue to use all the tools we have with regard to slowing the spread of the virus, making sure that you're keeping that 6 foot of distance between you and other people in public, that you're washing your hands often, staying home when you're sick, that's important, wear a mask when you go to the store. All these things will help us preserve our hospital capacity. We have been able to do that throughout the entire pandemic. We've got 31% of our hospital beds available, 32% of our ICU beds available, and 72% of our ventilators available. Hospitalizations are currently at 515, which means we're roughly between 12 and 13% of all of our hospital beds are being taken by coronavirus patients. That puts us in the blue zone. But again, I want to thank Nebraskans who are doing a great job of helping slow down the spread of the virus from our peak we had in November. We need to continue to remain diligent about slowing the spread of the virus. Also, avoiding the 3 C's, those crowded places, confined spaces, close contact. It's a virus that spreads from one person to another, so if you avoid those places, you'll be able to help slow down the spread of the virus. Now, we had a question on Monday with regard to the UK strain of the coronavirus, the new strain that was discovered in the UK and has been reported in 3 states, including Colorado. This strain is called the B117 strain, and it is reported to be more infectious. Though while we're still learning more about it, it does not appear that it's going to be more severe and that we'll respond back to the vaccine. But to talk a little bit more detail about that today, we have our Chief Medical Officer, Dr. Gary Anthone, who is going to be joining us by Zoom here today to go into a little bit more detail about that B117 virus. So with that, Ryan, can you bring Dr. Anthone on? Hello, Dr. Anthone. How you doing?
Doing well, Governor. Thank you.
Good, good. So I just introduced you, and the topic of talking about the B117 strain of the UK strain for COVID-19. You want to give us a little bit more information about what we know about this?
Sure. I have about a 5-6 minute presentation here, and Ryan, if you could go to the first slide for me. So back in September of this year, a new strain of the SARS-CoV-2 virus, now it's called the B117 UK strain, was identified in the United Kingdom. And it was around December of this year that they noticed that it was becoming more and more prominent as the cause of their infections. So as the governor just mentioned, it's now been identified in 5 US states. As of last night, we've had Colorado, California, Florida, New York, and Georgia all report specimens showing this new UK strain in their test specimens. So the reason we're talking about this is because it does appear that this new strain is more infectious or more easily transmissible. And I'll have a table with some data from the UK that will show this in one of my slides. However, it does not appear at this time to cause a more severe infection once it is transmitted to that patient. So far, with the data we have, it does appear that it will be covered by the vaccine products that we have being distributed at this time. And it does appear that it is detected by current testing platforms. In other words, the Test Nebraska and the NPHL labs, other labs in Nebraska can detect the SARS-CoV, even though it might be this mutant strain, but it won't tell you at this time, and I'll go into this at the end, that it is definitely the UK strain. It just says, yes, you are infected by SARS-CoV-2. So if we go to the next slide, Ryan. So the reason this happened is because viruses mutate all the time. It's a very common thing that we know. And these mutations that are taking place with this UK strain are on the messenger RNA sequence that codes for these spike proteins. If you remember, the virus contains an RNA strand in its inner core, is then surrounded by an envelope or membrane, and that's in orange. And then on this membrane are these spike proteins. We go to the next slide, Ryan. The spike proteins on the virus are what allows the virus to attach to the human cells and then cause an infection. So if you can see, the brown line is the membrane of the human cell, and that Y-shaped particle, molecule on the membrane of the human cell is called the receptor that then binds that virus. And these receptors on the human cells are called ACE, ACE-2 receptors. It's a very common receptor on cells in the lungs, GI tract, and other places of the body. But if the spike protein is not a good fit, it will not attach to that receptor on the cell. So what is happening with this new UK strain is that it's allowing these mutated spike proteins to attach to the cell ACE receptor easier than the wild type SARS-CoV before this mutant strain. And once that virus attaches to the cell, then the viral RNA gets into the cell of the human and then replicates and causes the infection. So if we go to the next slide, Ryan. So this shows the spike protein in sort of a three-dimensional view. And two of the spike proteins are what we think, the mutations on these spike proteins are what allows it to bind to these ACE receptors to cause an easier transmissibility. I won't go into the receptors, but are the spike protein mutations, but there's three mutations on that mRNA strand that allow it to bind to the human cell easier than the normal variant. So we go to the next slide. So in the United Kingdom, they did a study with 1,769 B117 cases and compared it to 1,769 normal SARS-CoV or COVID-19 strain cases. And you can see that the number of patients hospitalized in the B117 was 16, and in the normal strain, 26. This was not a statistically significant difference in hospitalizations. And then as far as deaths go, there were 0.9% deaths in those 1,769 B117 cases compared to 0.7% in the normal strain cases. Again, not statistically significant. But what was statistically significant was the transmission rate. The transmission rate is the percentage of patients that come in close contact with that patient infected with the B117 strain can be passed on 15% of the time if you're a close contact. Whereas for the normal SARS-CoV, it's a 10% transmission rate. So this new mutant UK strain, the B117 strain, increased the transmissibility by a factor of about 1.5. So if we go to the next slide, Ryan. So it's, first of all, we know, and it's well known that mutations commonly take place during viral replication. It's just a fact of life that that's what happens. This UK strain B117 mutation appears to increase the transmissibility of the virus. Now, since this variant is more easily spread, it could possibly lead to an increase of hospitalizations, and that's why we're concerned with it. It doesn't appear to increase the mortality or the seriousness of the infection, but it could lead to an increase in hospitalizations down the road. So the reason we are even talking about this is now even stresses the need more than ever to continue the practice of wearing your mask, keeping your distance, washing your hands, following the 3 C's as the governor goes over in his press conferences every time. And hopefully we can keep this under control as we roll out our vaccinations. So I'll end it there, Governor, and turn it back to you.
Sure, and just one other thing, Dr. Anthone, that I would jump in on is that we are actively monitoring for this here in Nebraska. So as Dr. Anthone mentioned, there are the tests that we typically run are not going to point out that this is the mutant variety, the B117, that is coming up in our normal Test Nebraska tests or so forth. There is one of the tests that will detect it, though, is called the Thermo Fisher TAC path, and that one will show the spike proteins dropping out of the test. It still comes back as a test positive, so the person still knows that they've been tested positive for coronavirus. But this Thermo Fisher TAC path will detect that spike protein is being dropped. I think it's called an S drop. Is that right, Dr. Anthone?
And I'm glad you mentioned this, Governor, because you just saved me from answering a bunch of questions, so thank you very much. But yes, right now, there are certain commercial labs that can detect this, what's called the S gene drop-off. And then, so there are some people in Nebraska that get their labs done and sent to a commercial lab. So if they're going to detect that, they will send it back to our public health lab, and then we'll sequence that to determine that. And the way I understand it, Governor, is the Nebraska Public Health Lab at this point in time is purchasing and should have it up and running fairly soon, this S-gene drop-off platform, this Thermo Fisher platform of testing for that S-gene drop-off. So probably will be up and running within a week or so.
Right, so if we are able to detect it either through one of the commercial labs that Dr. Anthone is referencing, or once we get to our own Thermo Fisher TAC path up and running at the Nebraska Public Health Lab, and we get one that we suspect they're tested positive, then we will sequence that to confirm that it is indeed the B117 mutant variation of the coronavirus. So we are going to be actively looking for that here in Nebraska. Of course, Colorado is obviously our next door neighbor to the west. So if they have experienced this, it seems like we might be able to, or that we might experience this as well, certainly in the western part of the state. And so we'll be actively monitoring and looking to see if that strain ends up coming to Nebraska. And of course, again, as Dr. Anthone pointed out, this is another great reason why we need to continue to practice all the tools that we have to be able to slow down the spread of the virus here in Nebraska. Does that kind of cover it, Dr. Anthone?
I think so, Governor. Thank you.
Great. Thank you very much. Appreciate it. All right. So before we get into questions and the upcoming schedule, I do want to take a moment to address a tweet that AOC sent out last night. AOC is someone who does not care about Nebraska. There have been far-left Democrat activists who have been tweeting out fake news, and she just picked up this fake news and tweeted it out without finding out what the facts of the ground are, what our vaccine plan was here in Nebraska. And it just, again, demonstrates that she doesn't care about Nebraska or the people in Nebraska. AOC is somebody who wants to have open borders. She wants to have socialism. She is the one who promoted the new Green Deal, which would destroy the cattle industry here in Nebraska, our #1 industry. She doesn't care about Nebraska, and despite the tweets of AOC, we're going to continue to work our vaccination plan here in Nebraska and do what's right for Nebraska. So with that, I'll go ahead and just remind everybody, we've got the upcoming schedule is Friday at 10 a.m. that we will have our next press briefing. And then next week, the State of the State address will be at 10 a.m. on Thursday, January 14th. We do have some questions that were submitted ahead of time. We're going to start with Bailey Bischoff at KOLN. I've seen some reporting in other states that there's an issue with getting healthcare workers their second dose of the vaccine. Have we run into the problem here in Nebraska? Is that a concern? I have not heard of anything with regard to those types of problems here in Nebraska, so I don't believe that that's a concern at this point. Her next question is, how long are vaccines able to stay in freezers, refrigerators before they expire? Will Nebraska be using this before that happens. So with the Moderna product, that can remain refrigerated for 30 days. So obviously, we expect that those will be used before that lapse of time. And with regard to how long they keep frozen, again, there was no expiration date that we're aware of right now on how long, and so we would expect that those would all be used. Once you kind of take it out of that refrigeration, you do have to use the Moderna, if it's going to be warmer within 12 hours. And for the Pfizer, once you thaw and dilute it, now remember, Pfizer is the one that has to be kept ultra cold. So once you thaw and dilute it, it has to be used within 6 hours. And that does get to the point that you may see reports, for example, of someone who is not in one of our priority groups getting a vaccine, and that's because we don't want any vaccines to go to waste. So if a public health department, for example, is inoculating a group of our priority folks and they have some leftover vaccines because maybe somebody didn't show up, they are going to make sure that those vaccines go in arms so that we don't waste any of those vaccines. So we are making a priority on that. And then, Taylor, I don't know, did we get any additional information on the Pfizer product about how long it can? 5 days in the fridge. And Pfizer can remain 5 days in the fridge. So that's how long those will keep. And then Bailey asked, what is the vaccine distribution process? Are the 60,000 plus vaccines that the state has been given in different healthcare facilities waiting for them to be used, or does the state have a cold storage facility somewhere waiting to go out? The way it works is that those vaccines are shipped directly either to the pharmacies for the pharmacy program, so that's Walgreens, CVS, Community Pharmacy, to be able to be distributed. So we don't take possession of those go directly to the pharmacies. They are working right now to schedule those long-term care facilities and be able to get that out as quickly as possible. The other vaccines are being shipped either directly to hospitals or to local public health departments where they're being kept. So the state isn't actually taking direct possession of those either. Those are going either to local public health departments or to the hospitals. We talked about some of those, especially if we're talking about Pfizer, they go to the ones with the ultra cold storage. So they're at those facilities, and those folks are the ones that are waiting to distribute them. So that's what the process is with regard to getting those vaccines out. Tyson Hrvanik from KRGI asks, by saying they, this is from a comment from Monday, by saying they need to be legal citizens of the U.S. to get a vaccine, is the governor admitting that there are illegals working at these plants? And if so, why isn't a state agency stepping in to investigate? So again, let me go back to our conversation from Monday. To be able to be working at these plants, the plants check to make sure that people are not using identity theft to get the jobs illegally. So you have to be legal to be able to working at these plants. So by definition then, by matter of law, and again, the companies are very diligent about this, you're legal if you're working at these plants. If somebody is breaking the law, if somebody is using a fake, a purchased identity or using identity theft to be able to work there illegally, that is either the responsibility, if that's happening, if the company discovers that, to report it to ICE if they suspect the person is not here legally, but that's not a state function to investigate that. So again, my understanding is the companies are very diligent about this. We expect that there's going to be vaccines for all Nebraskans, and just like any other vaccine, your citizenship is not checked before you receive a vaccine, so just like all vaccines. But again, by matter of law, if you're working at one of these facilities, you're supposed to be legal. All right, so Ruda Ulsanaiti from KMTV asks, will meatpacking plant workers be asked to show some sort of identification before getting vaccinated to prove legality to work or live in the U.S.? And again, if by definition, if you're working there, you've already had to prove that you're a legal citizen to be able to you're legally able to work in the facility. So no, they won't be asked to show any additional ID like any other vaccine program. That's not one of the things that we don't ask for proof of citizenship. Is Nebraska going to prioritize citizens and legal residents ahead of illegal immigrants when it comes to vaccine distribution at meatpacking plants? And again, this gets back to be working there, you have to be legal. If you're stealing somebody's identity to work there, that's illegal, but that's a different matter. This is something that we're not going to check immigration status when you're getting the vaccine at a meatpacking plant, because that should have already been done before you could take the job there in the first place. All right, Taylor, what other questions do we have?
Chris Dunker says that there's confusion about why the vaccination plan is marked draft
So Chris Dunker's asking, there's some confusion about why is the vaccination plan marked draft? Is this the final plan? And that gets back to the vaccination plan is a living document. It is subject to change. So for example, when the ACIP came out and said that 75-year-old plus needs to be a priority, we moved them into tier 1 of phase 1B, so our plan changed. So the plan we published is the current plan we're following, but it is subject to change if we get additional guidance from ACIP.
Brent from Channel 8 says that this week's White House coded task force report says Nebraska's vaccination campaign and messaging is an excellent example for other states. What's your response to that?
So, I'm sorry, that was Brent from where?
Channel 8.
Brent from Channel 8 says that the White House has pointed out that Nebraska's vaccination plan and communication strategy is a model for the country, and we appreciate the compliment, and I want to thank all the folks who've worked so hard to put together our vaccination plan and those folks who are working hard to implement that plan. So whether it's the folks here we have in our own public health department here at the state or all the folks in the local public health departments and the hospitals across the state, I want to thank them for all their great work to put together this plan and as we implement this plan.
He says the report also says no vaccines should be in freezers, but should be put in arms right now, and that aggressive immunization will save lives. What is the state doing to get those doses to people?
So Brent also says that this White House report that complimented Nebraska is also saying that no vaccines should be in freezers, that they all should be in arms, that aggressive vaccination will help save lives, and we agree with that 100%. We are working to be able to get these vaccines out. Again, I think we just need to remember that when you're talking about, say, the pharmacy program, the federal pharmacy program, that those vaccines go to the pharmacies, then the pharmacies need to coordinate with the long-term care facilities to be able to get the vaccinators out there, find out who's willing to take that. So there's a logistical issue there. And then, of course, when we're talking about hospitals, we got to make sure that when you're vaccinating people, that if there's side effects, you don't, for example, take out an entire shift of hospital workers so that you don't have people to staff the hospital. So there are logistics that all go around being able to get this done. But I don't think anybody is being lackadaisical about trying to get this done as quickly as possible. All right. Questions from the room? Andrew.
I had a question about the vaccine, the monitoring of this new strain. Will you be able to go back and tell, will you do that? Will you go back and try to see some of the positives that we had to see if that new strain was in the current positives?
So the question Andrew is asking is, will we go back and look at previous specimens to see if the virus had already been here in the state? And our plan is not to go back and look at it. What we're doing is going to be monitoring currently the specimens that are coming in, using that Thermo Fisher TAC path to be able to see any specimens that are going to the Nebraska Public Health Lab. We'll be able to test them there directly. We're also working with commercial labs that if they see this S gene drop and suspect that then that is the B117 strain of this, that they contact us, we get a sample of that specimen, and then we'll sequence it at the Nebraska Public Health Lab to confirm it's actually B117. So we're actively monitoring and looking for it right now with current specimens, but we're not going to go back in time and look for it. Grant.
Have you seen any estimates of when it might actually show up here?
And so Grant's asking, have we seen any estimates when we think it might actually show up here? I've not seen any estimates of when it might show up here, but given the fact that it is more infectious than the regular coronavirus and Colorado is next door to us, I think it's reasonable to expect that we may see this, especially in the western part of the state, here in the foreseeable future.
And Dr. Anthone, did he already take off? Did he already do?
Is Dr. Antone still on there?
Yes, I am.
Yes, Dr. Antone's still here.
Yeah, the little graphic was while you were speaking, is there a chance to just kind of run through the bullet points very quickly, as you're sitting there, what you want to let people know about this new strain?
So I don't know if you can hear that, but could you just run through the bullet points again, what you want people to know about this new strain?
Well, I think the previous question is, when will it be in Nebraska? I mean, we could almost say with some certainty that it's most likely there are probably some of those mutant strains here in Nebraska. And I think this is sort of an opportune time that the vaccine came out at around the same time that this mutant strain will be maybe showing more prevalence here. And I think hopefully it'll sort of balance itself out. But it still means, like we said at the end of that summary slide, I think it's more important than ever that we stress those non-pharmaceutical interventions as far as wearing a mask and avoiding the 3 C's. So I think we're sort of in a good timing as far as that goes. And as long as we have evidence that the vaccine is covering this new strain in addition to the old strain, hopefully we'll have good result going forward.
And also, how important will testing going forward continue to be in this?
And so the question was, how important will testing continue to be going forward? And absolutely, we want people to continue to take advantage of testnebraska.com. Testing, especially with the new strain of the virus that is going to be more infectious, it is going to be important for people to follow our rules. Look, if you're sick, please stay home and go get tested, because if you get tested and you're tested positive, as this new strain comes to Nebraska and becomes more prevalent, it means you're going to be more infectious. So we really do need people to really remain diligent about following our rules, using the tools, and getting tested if you suspect you've had a close contact, or it's just if you're going to be traveling, if you're going to go be seeing family. Those are all great opportunities to be able to go get tested and make sure you don't have the virus.
And is there any indication that this latches on to kids more than others, or any population group more than others, demographic group?
Is there any indication, Dr. Anthone, that this will infect kids more or any other demographic population more than any other?
I have not heard any information on that it does affect any different population any more than any others, except, probably if you're in more crowded spaces and, maybe a more dense, highly dense area, it's going to definitely increase your transmissibility rate. But no specific populations.
We have a question from Jeff Robb. Do we believe the strain is already in Nebraska?
So Jeff Robb from the Omaha World Herald is asking, do we believe that the strain is already in Nebraska? And as Dr. Anthone said, he believes it's likely, that we do have people who have it here in Nebraska, given our proximity to Colorado, but we don't have any proof of that, and we're monitoring it right now for it.
We have time for
One last question. Okay, I'm not seeing any last questions, so we'll go ahead and wrap up. Again, folks, I want to say thank you for joining us here today. Please remember to use the tools we've given you to slow the spread of the virus, especially in light of the B117, to make sure that you're keeping that 6 foot of distance, you're wearing a mask when you go to the store, washing your hands, stay home when you're sick, avoiding the 3 C's. This will all help us slow down the spread of the virus, especially as we have a more transmissible virus here in the B117. And also just want to congratulate the legislature on coming back into session today, and wish them well as they kick off this 90-day session. And we'll look forward to working with them to push forward on the work of the people in Nebraska. Thank you all very much, and we'll see you all again at 10 a.m. on Friday. Thank you, Francis.